So today we're going to perform using a handheld resuscitation bag and mask to a patient. So the purpose for this is to provide proper ventilation and to provide oxygen if the patient is needing it. So if a non-medical emergency, it's always important to first make sure the scene is safe and make sure to introduce yourself even if the patient is unconscious. So sir, my name is John Isorano. I'm a student nurse from DMC. Today I'm going to perform using a handheld bag and mask to you. So first, put on your PPE. So I'm just going to use my disposable gloves. So after putting on your gloves, make sure you have a face shield on. So assuming we have a face shield on, so it's important to make sure there's an oxygen tank in every hospital. So assuming that we have an oxygen tank here, we're just going to but first before we do that, make sure the patient's mouth is open. If the patient's mouth is not open, you can do a jaw thrust technique, and this will help open the patient's mouth. And now we're going to put a oxygen mask on him. So assuming we have an oxygen mask here, since I don't have any oxygen mask here, so assuming we're going to turn on the oxygen tank and we're going to put 10 to 15 liters of oxygen to the patient. So assuming that this is our BVM or bag ventilation mask, not bag ventilation mask, so we can remove the oxygen mask here. Make it assuming that this is the area where you can put the mask on. We can put it on the patient's mouth, and then make sure the patient's mouth is open using your dominant hand, and using your non-dominant hand you can press the bag area and deliver oxygen to the patient for 2 to 3 seconds. And you do this until the patient gains rescue, until the patient's breathing returns. So assuming that the patient's breathing has returned, you can dispose of the BVM, dispose of your face shield and gloves. And after this, make sure the patient is in a comfortable position, and then do aftercare and document everything you find on what you did for the procedure. So sir, thank you for letting me do the procedure to you.
Thank you.
Thank you.